Hello. So for today, we're going to discuss the step-by-step process of blood donation. We're going to talk about what you need to do for donating blood and the requirements you need to have to be an acceptable blood donor. We're also going to talk about what you need to do before and after donating blood, and we're going to go into details into the step-by-step process of the blood donation itself. When going to a blood donation center, donors must first register. Of course, before donating, donors must present their donor ID or any suitable ID for identification. To prevent ineligible donors from donating again, every donor must be checked against a permanent record of previously deferred donors. The questionnaire includes a health assessment which asks the patient's current and past conditions, from diabetes to more severe diseases such as Chagas disease or HIV. At the end of the health questionnaire is a consent form confirming the donor's understanding of the blood donation process and that they fit the minimum age requirement for donating blood. The form also includes a medical history questionnaire that is first filled up by the donor and then tackled in an interview with a health personnel to confirm the validity of the donor's answers. The donor is given a pamphlet about blood donation so that they can read beforehand and become more familiar with the process as well as its significance in saving lives. After the interview, the donor undergoes physical examination to determine if they are in good condition to donate blood. Appearance, weight, temperature, hemoglobin, vitals, and the skin is inspected. Donors must weigh at least 110 pounds and need to have a temperature within 36.5 to 37.5 degrees Celsius. A medical personnel performs a finger prick puncture to the donor to examine their hemoglobin level. Alright, so since we're done with checking your vitals, we're gonna do a finger prick. So I'll just prick your finger real fast. This isn't gonna hurt, to check your hemoglobin level. So basically, to be an acceptable blood donor, you have to have a 12.5 grams per deciliter of hemoglobin. So we're gonna check that. As you see from the video, the blood from the finger prick will be immediately wiped out, but in a proper blood donation process, the blood is tested for its hemoglobin level. Okay, since we're done with your physical examination, we're gonna collect your blood now. So kindly just give me your hand. So have you had breakfast today?
I did.
Okay, that's good because it's really hard to get your blood collected if you didn't eat anything before. The site of collection is cleaned with PVP iodine or polymer iodine complex and scrubbed at least 4 centimeters for 30 seconds. So what we're doing, this is a basic venipuncture, but in a proper blood donation, we usually use PVP iodine or a polymer iodine complex to cleanse your venipuncture area. Is that tight enough?
Yes.
Okay, it's okay to look away, but this isn't gonna hurt so much. After the needle
Take a
is
deep
inserted
breath.
properly, a
Good
tape
now.
is put on the donor's arm to hold needle in place. The donor will be asked to open and close their hand every 10 to 12 seconds during the procedure. A unit containing a volume of 405 to 550 ml should weigh between 429 to 583 grams. If the volume of the blood collected is below the range, it must be labeled as low volume unit because FFP or fresh frozen plasma cannot be made from it.
And just hold that, please. Thank you.
Before the needle is removed from the donor's arm, the pilot tubes are filled. Alright, so after we collect your blood, we have to mix it 8 times to be precise so that it won't clot. And we're good. I'm just gonna put some tape on your cotton. We're good to go. Thank you.
Thanks.
So thank you for donating your blood. Now that you're done, you need to be hydrated and call us if you ever feel dizzy or anything. And it's also important that you don't do any strenuous activity so that you won't put any damage to the part you collected on. And then just head over to the refreshments area so that they can give you snacks to replenish your energy. And then, yeah, that's all. Thank you.
Thanks.
No.
Why did